Hi, I'm Dr. B, and I want to talk to you today a little bit about Smart Lipo. With this device, we did the old-fashioned liposuction in which we stroked and out came the fat through this cannula through a simple suction system. Often we would sort of thicken up the fat and decrease the blood supply to the fat, so we got out almost pure fat when we did the suctioning, and this system worked pretty well. Some doctors would mystify that technique by giving it the fancy name tumescent liposuction, but basically this is the general kind of technique that most doctors use. Also, they would say they were melting the fat with the tumescent fluid, but again, what they were simply doing was filling up the area of the fluid to reduce the bleeding and to make the fat layer thicker and go up the cannula easily, which is a definitely beneficial technique, but certainly nothing novel. A few years ago, the Smart Lipo system was introduced. What this system does is it doesn't suction out the fat. All it does is simply burn the fat or cook the fat or destroy the fat while it is in your tissue. As you can see, with the Smart Lipo laser, the energy is going through a simple wire that's no larger than a hypodermic needle that we might use to draw your blood, or even something smaller than that. So through this very fine wire, we would then simply cook the fat. What happens to the fat after it's been cooked? That's everyone's concern. They think this fat is going to end up somewhere. Your body will simply destroy it, just as if we injected chicken fat underneath your skin. Your body will reabsorb the fatty acids in the fat, and it will get absorbed into your system and disappear. How much fat can you get out with this system? That's a whole different question. This is a very fine wire, and even if I put a lot of strokes back and forth into the tissue, it's only going to burn a certain amount of fat. And it's only going to kind of burn parts of the fat. And then there's going to be parts of the fat where once the other fat has been melted, the heat of the laser is going to be dissipated and the fat cells won't get killed. So this is a great technique for small areas, and it's a great technique for areas where they're hard to get to, or areas where you really want to get some definition out of. It can be helpful for cellulite. It can be helpful when when the doctor wants to get close to the skin. Because with this wire, if it gets close to the skin, it will tend to heat up the skin, and it will tend to cause a little extra collagen to be produced from the inflammation of this wire. So in some sense, the bottom layer of your skin is a layer of collagen, which is a layer of scar tissue. And what this is going to do is thicken up that scar tissue a little bit and tend to smooth things out and tighten the skin a little bit, as well as burning the fat underneath. In some patients who are adverse to the larger puncture site, and certainly there is some added trauma the more you do. The more of whatever you do, there's added trauma or injury to the skin. But with the wire alone, the trauma is pretty minimal, and the recovery is very easy. The area is swollen, maybe a little bruising, but not much. And of course, the puncture site is teeny weeny. With the larger cannula, the puncture site is a little bigger, might take a little more healing, and there will certainly be a little more bruising, but I can tell you I will get out some fat by the addition of the cannula that I wouldn't get out with the laser. With the laser, there may be also some fat that I get out that I wouldn't get out with this alone. When I'm routinely doing liposuction with the regular cannula, I tell people I get out about 70–75% of the fat in the area no matter what I do. Eventually, I'm just poking holes back in Swiss cheese. And at the end of the procedure, when it all heals together, that accordion of Swiss cheese will squish down, but there'll still be some fat along the muscle tissue, fat along the skin. That's where something like this Smart Lipo laser wire can go in and likewise dissolve that fat as well. Even with the two techniques together, most of the areas are still going to have some fat remaining anyway, but the result, I believe, is significantly improved. So Smart Lipo is a new technique. It does have some benefits in some areas. It certainly doesn't minimize the fact that with regular liposuction, you often get a really dramatic improvement and a super result, and that and liposuction alone can be an extremely helpful procedure. And the addition of Smart Lipo, again, one high-tech step. It's not a revolution. For the right patient with the right amount of fat, the Smart Lipo can be a very helpful addition to it, as can other techniques.